Did you know that how well you sleep could be directly impacting your risk of developing type 2 diabetes? It's a connection many people overlook, but the science is clear. Poor sleep isn't just annoying, it could be seriously harming your metabolic health. In today's fast-paced world, getting enough sleep often feels like a luxury. Stress, busy schedules, and constant digital stimulation cut into our rest time. This widespread reduction in sleep is affecting a large part of the population. Many adults aren't getting the recommended 7 or more hours per night. This isn't just about feeling tired. It has significant consequences for our overall health and well-being. Type 2. Diabetes is a common long-term health condition. It's characterized by high blood sugar levels. This happens because the body either doesn't produce enough insulin or doesn't use insulin effectively. Insulin is a hormone that helps glucose, sugar, from food, get into your cells for energy. When insulin doesn't work right, sugar builds up in your bloodstream. This can lead to serious health problems over time. The number of people with type 2 diabetes has increased dramatically worldwide. While genetics and lifestyle factors like diet and exercise play a big role, research highlights another major factor. Your sleep habits are strongly linked to your risk. Understanding this connection is vital for prevention and management. It adds another crucial piece to the puzzle of metabolic health. Sleep is a complex biological process, not just downtime. It involves distinct phases, including non-REM, NRM, and REM sleep. We cycle through these phases multiple times each night. NREM sleep has 3 stages, with the deepest stage being crucial for physical restoration. These cycles are essential for many bodily functions. One of the key ways sleep connects to type 2 diabetes is through its effect on insulin sensitivity. Insulin helps move sugar from your blood into your cells. When you don't get enough sleep, your cells become less responsive to insulin. This reduced sensitivity means sugar stays in your bloodstream instead of entering cells. This is a hallmark of insulin resistance, a major factor in type 2 diabetes. Chronic sleep deprivation makes this problem worse. Your body has an internal clock called the circadian rhythm. This rhythm regulates many processes, including how your body handles glucose. Irregular sleep schedules, like those caused by shift work, can disrupt this clock. When your circadian rhythm is out of sync, it can negatively impact glucose metabolism. This disruption increases the risk of developing insulin resistance and type 2 diabetes. Keeping a regular sleep schedule is important. Sleep is also critical for regulating various hormones. Several of these hormones directly influence glucose metabolism. Lack of sleep can throw these hormones out of balance. For example, insufficient sleep can increase cortisol levels. Cortisol is a stress hormone that can raise blood sugar and contribute to insulin resistance. Growth hormone, also involved in glucose regulation, is released during sleep. The link between sleep and type 2 diabetes is not one-sided. Poor sleep increases your risk of developing diabetes, but diabetes itself can also cause sleep problems. Symptoms like increased thirst and frequent urination can wake you up at night. Fluctuations in blood sugar levels during sleep can also disrupt rest. This creates a challenging cycle. Most adults need 7 to 9 hours of sleep per night for optimal health. However, individual needs can vary. Both getting too little sleep and getting too much sleep have been linked to an increased risk of type 2 diabetes. Short sleep is often defined as less than 6 hours per night. Long sleep is typically more than 9 hours. Both extremes seem to pose a risk. Numerous studies show that consistently getting too little sleep increases the risk of type 2 diabetes. This link is influenced by several factors. Insufficient sleep can lead to unhealthy habits. These habits include poor food choices and less physical activity. Both are known risk factors for diabetes. Short sleep also disrupts hormonal balance, further increasing insulin resistance. While less common, sleeping for unusually long periods has also been associated with a higher risk of type 2 diabetes. This might seem counterintuitive. However, long sleep could be a sign of underlying health issues. It could also indicate poor sleep quality, even if the duration is long. These underlying problems can increase diabetes risk. Sometimes long sleep simply reflects abnormal sleep patterns. It's not just about how many hours you sleep. The quality of your sleep is equally important. Even if you spend enough time in bed, interrupted or poor quality sleep can still put you at risk. Sleep disturbances can worsen diabetes risk factors. Conditions like sleep apnea, restless leg syndrome, and insomnia are examples. These issues can significantly impact metabolic health. Insomnia, characterized by difficulty falling or staying asleep, is linked to a higher chance of developing type 2 diabetes. Chronic sleeplessness can lead to increased stress. It can also cause hormone imbalances and poor glucose metabolism. The relationship between diabetes and sleep is complex and interconnected. Addressing insomnia is crucial for managing diabetes risk. Sleep apnea is a common sleep disorder where breathing repeatedly stops and starts during sleep. It's been identified as a significant risk factor for type 2 diabetes. People with diabetes are also much more likely to have sleep apnea. The pauses in breathing cause drops in oxygen levels and disrupt sleep. This can lead to insulin resistance and higher blood sugar levels. It's a strong link, especially in overweight individuals. Restless leg syndrome, RLS, is a neurological condition causing an irresistible urge to move the legs. It's often accompanied by uncomfortable sensations. RLS can severely disrupt sleep. This disturbed sleep lowers overall restfulness. It may also contribute to an increased risk of diabetes. Addressing RLS is important for sleep and metabolic health. Sleep problems don't just affect blood sugar, they significantly impact quality of life for people with type 2 diabetes. Poor sleep can worsen mood, increase fatigue, and make it harder to manage the condition. It can create a vicious cycle. Symptoms like frequent nighttime urination or excessive daytime sleepiness are common. These symptoms can severely lower a person's quality of life. Knowing the close association between type 2 diabetes and sleep highlights the need for a holistic approach to health. It's not just about diet and exercise. Proper sleep hygiene and addressing sleep problems are equally vital. By tackling all these risk factors together, individuals can lower their risk of developing type 2 diabetes. They can also improve their overall well-being and quality of life. If you have diabetes or are at risk, evaluating your sleep is crucial. Healthcare providers should ask about sleep habits during checkups. They should look for signs of sleep disorders. Questions might include difficulty falling or staying asleep, daytime sleepiness, or snoring. Keeping a sleep diary can provide valuable information. Screening for depression is also important, as it often coexists with diabetes and sleep issues. While a good medical history can identify many sleep problems, some require further testing. A polysomnogram, or overnight sleep study, is often needed to confirm sleep apnea. This test monitors various bodily functions during sleep. If medical and psychological causes are ruled out, a diagnosis of primary insomnia may be made. Accurate diagnosis is the first step toward effective treatment. Treating sleep problems can be very beneficial, especially for those with diabetes. Management often involves addressing underlying conditions and reducing symptoms. It requires a multifaceted approach. Good sleep hygiene is fundamental. This includes maintaining a regular sleep schedule, creating a relaxing bedtime routine, and ensuring your bedroom is dark, quiet, and cool. Behavioral measures are key to managing insomnia. Techniques like sleep restriction, cognitive behavioral therapy for insomnia, CBTI, and relaxation exercises can be very effective. These therapies help change thoughts and behaviors that interfere with sleep. They provide long-term strategies for improving sleep quality. For some sleep disorders, medication may be helpful. This can include medications for insomnia or devices like continuous positive airway pressure, CPAP. For sleep apnea, CPAP therapy helps keep airways open during sleep. Studies show CPAP can improve blood sugar control and insulin resistance in people with both conditions. Sleep disturbances are common in people with type 2 diabetes and significantly impact health and quality of life. Both short and long sleep durations, as well as poor sleep quality, are linked to increased diabetes risk and worse blood sugar control. Conditions like sleep apnea are particularly prevalent and harmful. Healthcare providers treating diabetes patients must pay close attention to sleep problems. Addressing sleep issues should be a standard part of diabetes care. Sleep education is a vital tool in managing this condition. Prioritizing healthy sleep is essential for everyone, especially if you have diabetes or are at risk. Aim for 7 to 9 hours of quality sleep each night. Maintain a consistent sleep schedule, even on weekends. If you experience symptoms like excessive snoring, daytime sleepiness, or difficulty sleeping, talk to your doctor. Don't ignore sleep problems. They could be impacting your diabetes or increasing your risk. Your sleep is a powerful tool for managing your health. Don't let poor sleep put you at greater risk for type 2 diabetes or make managing it harder. Take control of your sleep habits today. Talk to your healthcare provider about any sleep concerns you have. Ask for a sleep evaluation if needed. Learn about good sleep hygiene and make it a priority in your life. Share this information with friends and family to raise awareness about this critical connection. Your health and your sleep are worth it.